I would put it in order for a patient who maybe had a heart attack, okay? And so the food that they would get had to be a cardiac diet. So I'd round on the patients the next morning. I look at the food tray like, did I put in the wrong order? No, I did not put in the wrong order. They simply got a cardiac diet that's going to be food that continues to fuel them into having worsening of their disease, brings them back into the hospital, and unfortunately, possibly even have another heart attack within the next 6 months.
This is the Healthy Lifestyle Solutions podcast, and I'm your host, Maya Acosta. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life and increase our longevity in a good way. Let's get started. All right, welcome back to another episode, my friends. As you know, I'm highlighting women that I interviewed at the Vegan Women's Summit. So, welcome to this captivating interview with Dr. Janel Gordon, a leading expert in lifestyle medicine. Dr. Gordon joins me in this episode to discuss the groundbreaking Food is Medicine panel at the Vegan Women's Summit. She delves into the critical question: is plant-based nutrition the answer to our healthcare crisis? With alarming statistics on chronic diseases and skyrocketing healthcare costs, Dr. Gordon reveals how our dietary choices play a pivotal role in our overall well-being. Drawing from her expertise in family, obesity, and lifestyle medicine, she shares her journey in empowering patients to take charge of their health. Dr. Gordon's commitment to practicing what she preaches shines through as she emphasizes its practical impact on patient outcomes. As always, the full bio and the links for each of my guests can be found on the website healthylifestylesolutions.org. Let's meet Dr. Gordon. I have Dr. Janel Gordon with me. I'm so excited. She was one of the panelists for the Food is Medicine panel. And so, welcome.
Hello, thanks for having me, Maya.
Yeah, I'm so excited to speak with you. You know, on my podcast, I often bring physicians to talk about health and, we talk about stress management, sleep, but nutrition is always the most important thing. So tell us a little bit about the discussion that took place earlier.
So the title was actually, Is Plant-Based Nutrition the Answer to the Healthcare Crisis? So we know that in this country we have a big problem when it comes to healthcare. The expenditure, the amount of money that we spend annually due to the chronic diseases that many of us are dealing with, it all goes back to the lifestyle choices we make. And number one, as you mentioned, is the nutrition or the foods that we're eating on a daily basis and the beverages that we're drinking as well.
So is nutrition, plant-based nutrition, the answer to the healthcare crisis that we have?
I believe it's one of the biggest answers to the crisis, okay? And there is a lot being done, especially cross collaboration among various industries to help communities do better, hospitals, schools. Right here in New York City, where we're hosting the Vegan Women's Summit, Mayor Eric Adams has helped institute Meatless Mondays in the New York City school system. The default diet order or nutrition order for patients when they're in the hospitals here in the New York City hospital system is plant-based nutrition. I mean, that's crazy. I always talk about back to when I was in training and seeing patients in the hospital. Now I practice primarily outpatient medicine. I would put it in order for a patient who maybe had a heart attack, okay? And so the food that they would get had to be a cardiac diet. So I'd round on the patients the next morning. I look at the food tray like, did I put in the wrong order? No, I did not put in the wrong order. They simply got a cardiac diet that's going to be food that continues to fuel them into having worsening of their disease, brings them back into the hospital, and unfortunately, possibly even have another heart attack within the next 6 months.
You know, it's fascinating that the hospital would not understand, and I know it's a business in many ways, but that they would not understand that the foods that they're feeding the patients are the same foods that got them into the hospital in the first place. For the most part, because we have other reasons why people are in the hospital. So tell us a little bit about your background, how you came on board, and I believe you're trained in lifestyle medicine, aren't you? So tell us about that as well.
Sure, yes. So I'm actually born and raised in Indiana. I always say I did all my education in the South after high school. So North Carolina, up to Kentucky, over to Maryland, and now back to Indiana. I'm board certified in family, obesity, and lifestyle medicine. Today I'm able to see individuals 2 years old and up. I work in an employer-sponsored healthcare space, so I see staff members and then their dependents. And I really do practice primary care with a lifestyle medicine approach.
I see the importance of trying to get to patients before they get so advanced that even lifestyle may not help as much. Tell me how that has changed your perspective as a physician.
Sure. So the way I was trained, I felt like I'm the doctor, I'm the expert. You come see me with a concern, a symptom that you're dealing with, and I tell you this is what you need to do, Maya. But through the lifestyle medicine approach, I really partner with patients. You're the one in the driver's seat, and I'm coming alongside you like the driving instructor saying, okay, Maya, where do you want to go? And show me how you plan to get there. And I might say, okay, it sounds great. Like, I love the energy, but I don't want you to burn out too soon. So, how can we break down this overarching goal that you have into more sustainable, realistic steps so that that doesn't happen and you get to where you want to be?
And then the individual feels like there's this partnership. You're working together for that individual's health. And what I love also about lifestyle medicine is that the physicians themselves practice what they preach. You do this for yourself as well.
It's interesting that you say that. I was just talking to someone here at the summit, and I was telling her that on my desk at work, I have a picture that I got when I was in Spain one time, and it's a man with a huge lettuce head, okay? And then I went to the American Academy of Family Physicians National Conference one year, and they give us ribbons to put at the end of our badges, and it says foodie. It's green because I love it, right? I love food. I love the color green, like you're wearing today. And the nurse said, wow, Dr. Gordon, like you actually practice what you preach. And I thought, I do. And it's sad that she even had to have that epiphany or that thought that you don't go and see a provider, a physician, and you expect that what they're sharing with you, telling you you should do, that they're not actually doing it. And studies actually back up that when the physicians, nurse practitioners, physician assistants, whatever provider you're seeing is actually practicing what they preach, you're more likely to have better outcomes as a patient.
I need to repeat that to some people that I know.
Yes.
you know, because the truth of the matter is, then it feels more like a wellness center. If you come into a space, say it's a private practice, for example, you come into the space, it's wellness. You feel it, you pick up on that energy. Tell us what it means to you to be here at the Vegan Women's Summit. You were part of the panel, but you're also here, I'm assuming, for yourself. So tell us tell me more about that.
Sure. So my first time attending the Vegan Women's Summit was last year in Los Angeles. It was my first conference since pre-pandemic, okay? I get there, feel like a fish fresh out of water, okay? But that's why we want to eat plant-based nutrition, because we want to keep the fish in the water, right? So anyway, I walk into this space. I sit down next to this woman. She just so happens to be from Indianapolis, Indiana, which is my hometown and where I live now. And I thought I'd be alone. She's like, oh, let me introduce you to this other lady who's also a physician by education and training, has her own vegan food brand now. Ended up meeting up with her at a conference in September last year after I met her at the Vegan Women's Summit. Fast forward to this week, like I'm in New York City for the Vegan Women's Summit. I go to Beatnik yesterday for lunch and someone read a shirt that I was wearing. I turn around and it's that woman who I first sat next to at the Vegan Women's Summit last year. And so it just shows you that like this is meant to be, that you're headed down the right path and these organic connections. It's like serendipity to me.
It's a beautiful vibe. I love being here. It's my first time coming. I also see it. I appreciate that there's that whole there are physicians that are also being represented here because it's about the food, it's about sustainability, the environment, and the animals, but health. So reminding ourselves that we're doing this for our health as well. So I love that. Tell me more about how my listeners can either learn more from you, follow you on social media, or anything else that you'd like to share.
Sure. So you can find me on LinkedIn and Instagram at Janel Gordon, MD. On LinkedIn, comma MD, but no punctuations, obviously, on Instagram. And if you have any thoughts that you want to share on how we can work together to help improve the health and well-being of others, not just individuals, but families, also, obviously, because I'm a family medicine physician and whole communities, then please reach out to me.
Do you go to the Lifestyle Medicine Conference? Because this year it's going to be in Denver.
In Denver, yes. Last year it was in Florida. Beautiful. Yes. So if it were not for the American College of Lifestyle Medicine, like I don't even believe I would be sitting here talking to you. I mean, those are your people, right? Like-minded individuals. And just preparing to take my board exam and now practicing it, not only is it changing the way I practice, but actually the way I live my own life. I spoke about the 6 pillars of lifestyle medicine back in February in Indianapolis. My mother sat in that audience and listened to me. Diabetes, high blood pressure, had a stroke in 2021. I thought my mother would never stop consuming animal products. She hasn't eaten it to this day. Not since February. She tells me she feels better, her knees don't hurt as bad. Her doctor has had to decrease her dose and frequency of the insulin that she takes. I mean, so it really does work, right?
So I love it. She saw you put on that doctor hat. So had it been in the kitchen, would she have listened then?
No, because I would have just been the daughter, right? And she knows I'm the daughter of the doctor, but in that space, I was the doctor, right?
You were the expert.
Yes. And so if you feel like you have people in your life who you want to share this information with and you've made the changes and you feel like they're not making the changes, try not to be so preachy, try to lead by example. But the more they can see the information, maybe from another source that you kind of put in front of them, even if it's, subtle or not so subtle, they're more likely to make the changes and just continue encouraging.
So actually, those are wonderful words of encouragement because many of us do not have loved ones that are on board. And when we first come on board, we want to get everyone on there, to do that. And then we become pushy. People feel judged. So the fact that you've laid back and you've been yourself doing your thing, and now your mother sees you in a platform where you're admired and respected, and you're an expert, it's just such a beautiful thing. Thank you so much. Did we share your social media?
Yes, we did.
Okay.
Again, Janel Gordon, MD on Instagram, and then LinkedIn, Janel Gordon, MD.
Thank you, Dr. Gordon, for stopping by. Dr. Janel Gordon leaves us with a powerful lesson in this enlightening interview. Our choices matter. Through her expertise in lifestyle medicine, she emphasizes the transformative impact of plant based nutrition on our health and urgent need for change in our healthcare system. Dr. Gordon's approach, grounded in partnership and leading by example, reminds us that true healing begins with personal commitment. It's time to empower ourselves and others to embrace the power of food as medicine. I hope that you enjoyed this interview from the Vegan Women's Summit that took place in New York. Look out for more of these great interviews in June as I highlight more great plant-based women. You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this content, please share with one friend who can benefit. You can also leave us a 5-star review at ratethispodcast.com/HLS. This helps us to spread our message. As always, thank you for being a listener.